All right, guys, we are back for another episode. Today, we have a very special guest. We have my mentor from chiropractic school, Dr. Joe Ford, chiropractor, certified sports chiropractic physician. He's actually the owner of Vitality Sports Medicine in Plano, Texas. He is also a treating chiropractor for multiple professional teams. And I'm going to go through the list here a little bit. The Dallas Cowboys, my team, Atlanta Falcons, New England Patriots. He's been a treating physician for the Dallas Stars, various different Baylor, where he went to school as well. And he's got such a long list of professional accolades. I'm going to let him kind of go through that as well. So Dr. Ford, thank you so much for coming on. Could you just please let everyone know who you are, where you're located, and some of the sports teams that you're affiliated with, or some of the teams that you've been treating players with for the past 10, 15 years?
Right. Well, I'm in Plano, Texas, as you know, inside the Star Center in Plano. It's branded now as the Children's Health Star Center. Used to be the Dr. Pepper Star Center, but Stars went with a new sponsorship deal. So it's Children's Health Star Center. And our office is right inside there, overlooking one of the sheets of the ice. I laugh. I just got such an awesome view every day. Watching kids out there, play hockey, and the figure skaters out there that we treat, training and trying to get ready for nationals and Olympics and stuff. It's a blessing every day. I absolutely love it. It's always comical. I know I told you, because I tell all my interns that, I'm really the Forrest Gump of chiropractic. Like, I'm telling you, I've been so blessed, just being in the right place at the right time, meeting the right people. And, like I tell you, told you as an intern, I tell all the interns, it's like, once you get that opportunity, you just want to make the most of it and do your best. And, I think if you're upfront and you're honest with the athletes and the teams, as well as just the regular patients, they're going to appreciate that. And one of the first things I had to learn was how to say, I don't know. And I think patients and athletes really began to respect that, because they knew I was going to go find out if I didn't know. And, the funny thing about that is you start learning and come to find out there's a little bit less that you don't know, right? But then just when you think you do, here comes something else that throws you a curveball, and you learn something new every day. So 26 years in practice, and I'm telling you, every day is just a blessing and a challenge. I tell the interns now, I'm like, I probably have an idea within the first 45 seconds of what's going on. But now I have to go in there and prove my assumption, right? So, they're sitting there worried about a 17-page exam, and I'm pretty much already have an idea what's going on. But like I said, now I got to go prove it. So anyway, working with the teams and trying to be thorough and do as good a job as I can. And I work on all parts of the body, all the extremities and stuff, and just always trying to get better, learning from, I learned from you when you were an intern. You were exceptional. I learned from all my interns and continuing ed and everything. You got to keep, honing your skill, right?
That's right, man. And you have probably one of the coolest offices that I've ever been to. And I was so fortunate, during my internship to be at your office. We were actually your first class. So we were the guinea pigs.
Right.
So we probably, did some stuff we weren't supposed to do. We probably played hockey a few times in the locker room. Shouldn't be saying this, but it was just such a cool, immersive experience, because we could actually watch, the hockey teams, the figure skaters, practice. And those are athletes that you were treating, and we could go watch their movement patterns right there in the ice. And you could say, okay, right, I can tell that their glute medius is weak, the way they're landing and the way their knee is going down. Because, it's such a cool experience. And I don't think a lot of people realize, hey, like, you are actually on site, like, full time. Like, I know you travel with the teams too, but you were actually on site in your practice, which is so
right.
So I know you've been doing this for a long time, and this field, as you said, like, there's so many times we say, I don't know, because the field is rapidly changing and current paradigms are shifting. I know when I first started sports in high school, it was like, hey, you got a static stretch, 15, 20 minutes. And we know now that static stretching actually can limit some athletic performance, can actually, overfire Golgi tendon organs.
Very true. That's something that definitely is, within the last decade, and learning more and more about that, and especially a lot of our fast twitch fiber athletes, always trying to find that balance of how much warm up and stretching to do, and how much to just get the blood flowing.
Yeah. So on that topic, what are some things that come right up on the top of your head that have kind of been things that you thought to be true maybe 10 years ago, but they are not true, and maybe you've learned something that's better in the form of sports recovery? Does anything come to mind?
Well, probably the dynamic cool down. We were, years ago it was about, let's just, when you get done, you heard you can do a cool down stretch. But then we kind of learned, well, if we can kind of do a little light resistance cool down, maybe some band work, some assisted stretching, things like that I think help flush the musculature a little bit better, because you get a little deeper contracture. Obviously, the old debate about ice versus heat, right? That always kind of roller coasters. There's phases in research that show, you need to ice to cool down, and then there's others telling you not to ice, and then there's the contrast therapy. But I would say in the last decade, the contrast therapy of the ice has become much more popular, and in my experience, just been much more effective for cooling down and helping prevent post-activity inflammation.
Nice. Let's talk about that, because there is, I don't know if everyone knows this, but in our world, everyone talks about, don't ice after an injury. We need healthy inflammation. I'm still on the camp that we need to ice. I believe we need to do more movement than rest. What are your ice and how to use both of those? That's
exactly right. And so that's, it's, I always laugh, because it's easy to say not to ice when you're the one not hurting, right?
Right.
So,
exactly.
Those poor guys and girls that are sitting there watching their ankle and knee swell up like a watermelon. It's a little harder to sell, but now again, learning, a little ice will go a long way. But like you said, that movement, that joint mobility, once you've ruled out instability of the joint and severe soft tissue damage, it needs that motion. And so a little bit of ice, just take the edge off, and then let's roll, buddy. Let's get that thing moving.
Right. And I forget the doctor's name who created the RICE principle, the rest, ice, compression, elevation. But now I think the new term should be MICE, movement, ice, compression, elevation. Getting some early motion in there. Of course, you don't have any fractures or, tears, but obviously getting some motion in there, letting that injury heal in the proper way, start, promoting those normal movement patterns. But yeah, right. Controversy and all of these things, which makes it kind of hard, because then you have a patient come in and they say, I'm not supposed to ice my injury. You're like, well, let's talk about that. It's, if you're worried about the ice not creating enough inflammation, it's not stopping inflammation. It's not a drug. It's just controlling excessive inflammation in my experience. So,
amen. And you also, I think you have to weigh in who it is you're talking to. We use the term athletes, and my practice, you know a ton of my patients, and not all of them are professional athletes, right? A lot of them are very active, very athletic, competing at a very high level in their chosen activity. But guess what? They got an 8-to-5 job too, or some form of a job that they may have to go sit at a desk. They may have to go hop on a.
You're filming me, Doc.
Consideration, and if you got an athlete that has to fly a lot, well, I mean, you're just asking for prolonged inflammatory response. Flying just is inflammation. And so, I got no trouble telling some of those people maybe to ice a little bit more to try to control that. Again, if you're a professional athlete, well, okay, you've got the ability to just totally shut it down and get home and rest and go up to the training room and, wear the compression boots and, all that other stuff. But the regular Joe, we got to take into consideration what their life is.
Right. Yeah. Sitting is the new smoking. So many people are sedentary, and hey, I've been over to pick up this pencil, wouldn't really do anything, and threw it in my back. You're like, well,
Amen.
Talk about
I tell people all the time, it's just as bad to go from 60 to 0 as it is from 0 to 60. I mean, in New Year's, right? We see all these new injuries with people and their New Year's resolutions, and they go from doing nothing to, I'm going to go CrossFit 5 days a week. And, maybe it's just, I'm just going to ride the bike 5 days a week, but they hadn't been doing anything for 2 years, 5 years, whatever, right? So that's 0 to 60. But it's also tough on these people that are super, super active. And then, like an example of the COVID quarantine, all the shut down and everything. And now then those people just came to a screeching halt of activity, and the body has a hard time adapting to that too.
Exactly. So that brings up a topic that I want to talk about with you. And I was, searching earlier this morning. I didn't find a specific injury increase, but if anyone watches sports, it just seems like there's a lot more injuries this year than there have been in years past. And I have an interesting study I want to reference before we talk about this. So after the 2011 NFL lockout, where, players obviously weren't playing for a substantial amount of time, there was 12 Achilles that were ruptured in the first 29 days versus 16 in the previous full 2 years combined. And we know that was because players, athletes were deconditioned going out there, putting a lot of force on these tendons and ligaments that weren't ready to have that amount of force put on them. But now, you saw the 49ers pretty much lost half of their offensive, in the first, 2 weeks. And so
Right.
Your thoughts on the injury rates for 2020 and with all the COVID stuff going on, Doc?
That is, it's very fascinating, and I really look forward to seeing, some of the stats come out, by the end of this year, and as they crunch those numbers and stuff. But, as I mainly worry about my fast twitch athletes. So, and if we're speaking of NFL, then, the wide receivers, the running backs, the DBs, those athletes with a high concentration of fast twitch fibers, because they're going to be wound tighter. They're the ones that typically tear their Achilles and those types of things. It's, very rarely the big offensive lineman with, a lot of slow twitch endurance fibers, right? But as we see, as these athletes get bigger, faster, stronger, what we used to call fast twitch fiber athletes, the small guys, like you see with the 49ers, that D line is just so athletic and so freakish that, we're seeing some of those fast twitch injuries on bodies that big.
Right.
Which again is not terribly different than what we've seen in the last 20, 30 years with the athletes and the ACL injuries, because, you can work out and be in the best shape of your life. There's no way to make that ACL bigger. You'll
Right.
make your joints bigger and your calves and all that stuff. But that ACL, that's a lot of pressure, especially, speaking of the 49ers, you get, Solomon Thomas or somebody, 340, cuts on a dime. Boy, that's just asking a lot out of that tendon. So, these are very interesting. And the interesting thing that I saw with so many of the Cowboys and a couple of Raiders that were here training that we were working with, they had a little bit more access to equipment nowadays than really you would have thought 10, 20 years ago. Not unusual for these guys with their money to have some pretty nice gyms in their house. But again, they don't have the high tech, motion equipment, the hammer strength and, that type of stuff. Typically, they'll have a ton of free weights, right? But, I would really emphasize to them, I really want you doing as much kinetic chain, compounded motion, movement replication, sport replication movement, and that you can. And a lot of them were able to do that in their houses or backyards or whatever. So, it was interesting, and we tried to get the word out to them, and they know it. But at the same time, Rob, you also know there's, no matter what level we're talking about, in this case, the NFL, there's still some guys that are, what shall we say, lazy, and so they just weren't going to be ready. And they're the same guys that show up at training camp out of shape, getting fined for being overweight. And so, those guys, that's a hard lesson for them to learn.
Right. It's the same concept for us. If we're to work out at home and do a workout versus us going to a gym or across the gym or whatever the case is with other people competing,
right?
We're on our own. We're not going to work out. We're going to work out hard, but probably not as hard as if we have someone right there with us. And same with professional athletes. They are the ultimate competitors. And so they need time on the field, and the lack of preseason this year especially is leading me to believe, hey, like a lot of this is, couldn't be avoided with COVID, obviously, but a lot of this could, in our world, if you're getting hurt, if you're an athlete getting hurt, you're losing money. And so these athletes get back on the field as quickly as possible. So that leads me to my next question is, what are, I know we got the Normatec boots, I know we got cryo. What are some of the other advancements that you've seen in the sports and medicine world that are really kind of changing the game or really evolving the way we look at injuries and the way that we, accelerate these injuries? Is there anything cool on the horizon you should know about?
The last 3 years I've been with USA Bobsled with their World Cup tour overseas and stuff. And what's really interesting from that standpoint, when you work in an international environment, you get to see what other countries and other Olympic committees are doing for their athletes and stuff. And I'm always fascinated by that. Obviously, Germany's really big in bobsled, and they spend a ton of money on their athletes and stuff. But I tell you, it's interesting in that I can't sit here and tell you I know of anything high tech, super cool, Star Wars type, machinery or gadgets, but it's just interesting to see the renewed importance of sports nutrition.
Nice.
Diet for sure, right? I mean, and that's a given. And all these elite athletes, whatever sport we're talking about, know the importance of a good diet. But really starting to pour themselves back into the research on sports nutrition, that extra boost, that therapeutic, that nutraceutical, whatever word you want to throw out there.
Mm-hmm.
And that's what I'm always fascinated about. In Germany, those athletes are so fascinating. Obviously Europe is much more cutting edge when it comes to its nutrition research and data and stuff. And so I always try to talk to their trainers and physios and stuff about what they're doing, and the various types of proteins, and even breaking down the types of proteins and what time of day they take that type of protein, the full complex whey or the collagen based, or they're really getting pretty high tech with that, and it's pretty fascinating.
Right. It's a whole thing, right? It's nutrition,
Right.
It's sleep, it's recovery, it's stretching, taking care of your body. And you brought up nutrition, which I'm excited to talk to you about, because you've been, doing this for a long time. Since I was there, you had, a product there for concussions, managing brain inflammation, helping antioxidants for the brain, for your post-concussive type patients. And you had a whole protocol that we were just learning, at your clinic back then. I think that's kind of evolved from what we've talked about earlier. And so can you kind of talk about some of the research that you've done with your new sports nutrition product? And you can mention some of the ingredients and the research that you've come across.
Well, interesting, Rob. I appreciate you bringing that up. It's a real passion of mine that started back in '08 when I was with the Patriots, and watching so many of those athletes that had concussions and how they were dealt with. It was the old-fashioned, hey, just go home, and when you feel better, come back. There was no training or recovery, or they wouldn't even tell. They may mention, hey, take some fish oil, right? But that was really what got my wheels turning about, there needs to be better intervention nutritionally with the concussion and mild traumatic brain injury. But then it evolved into just generalized brain health. I caught myself being so focused on the concussion aspect that, I really had forgotten that, it still backs up to total brain health. So that was the formulation of what's now called Ceregold. I have a patent on it. I'm very proud of it, all the work that went into it, and certainly not just me. Some of the biology physios that help work on the nutritional shielding, the absorption rates, the saturation points, things like that. So it's a well thought out supplement. But the point being is that I really wanted to attack the
Hold on, guys. We got a minor pause.
increase the permeability. We're trying to stabilize the permeability. So where the blood-brain barrier may be a little too permeable, we want to shore that up and solidify that. Where it's a little less maybe hypopermeable, we want to free that up. We need that good endothelial lining health in there so that we know we're getting optimum absorption as well as detoxification in and out of the brain. So attacking the blood-brain barrier stability was first and foremost for me. Obviously, the foundational supplement with that or ingredient with that is the ginkgo biloba, which has been around forever and people have known about it forever. I did run into some resistance from some PhDs in human nutrition initially.
Ginkgo?
Yeah, and one specifically told me that once he saw I had ginkgo in my supplement, that the study that I'd given him, he just tossed in the trash. He said, because you also remember or he told me, you obviously remember the study that showed ginkgo had no effect on blood-brain barrier, which again was one of my initial experiences with learning that just because you have a lot of initials after your name does not mean you know everything. And
Sure.
I told him, well, then you obviously didn't see the Zurich study 4 years later that showed it has a profound effect on blood-brain barrier permeability as long as the ginkgoloid concentration is at least 22%. He did not know about that. And so again, it was just one of those things you're just like, I'm not saying it's the cure-all be-all, whatever, but it's a very important ingredient. So foundationally, that was a big part of the blood-brain barrier. And then obviously a lot of cofactors, magnesium glutamate, blah, blah, blah. I won't bore everybody with the intricacies of it, but that first stage of stabilizing the blood-brain barrier is crucial so that you can get to the next two phases, which the second one is making sure we get a very high quality, high concentration dose of available magnesium to the mitochondria to keep these batteries churning inside our neurons here and try to salvage and save as many neurons that may be on life support as we can. So, I always joke around, there's no number that we know of. For example, a concussion says, oh, you got a concussion, it makes you lose 3 million neurons. We don't know that, right? But I would always joke around, what if we get enough magnesium to the damaged tissue, maybe we only lose 1 million. Right? So, looking at it from the standpoint of if we give the body what it needs and can get it there safely and efficiently, it's amazing what it'll pull off and what it can do. So
many people are deficient in magnesium as well. I mean, there's already studies that show athletes, because you lose magnesium during stress, one of the most critical, micronutrients that you lose. You also lose it in sweat.
Right. Well, it's one of those things too, where if there's inflammation in the brain, it makes it harder for the magnesium to cross the blood-brain barrier. That's why we use a patented form of magnesium that Axion Nutraceuticals in Phoenix owns the patent on. So we licensed that from them so we could use it because it's the only form of chelated magnesium that's proven to cross over an injured blood-brain barrier.
Right.
So, very, very happy to, have a company work with us like that and let us license their ingredients because it's crucial. So,
right.
And then the third and final phase or attack that I wanted to have in this was I wanted to make sure that the brain had available the building blocks, the precursors needed for the four main neurotransmitters of the brain. Pharmaceutical companies, when they initially started to try to move into the concussion treatment market, they initially jumped on with their serotonin reuptake inhibitor medications like Prozac, that they never made it out of phase 1 trials because they failed miserably because they were forcing the brain down a pathway where my assumption, and it goes back to our chiropractic assumption of the innate intelligence of the body, is I'm going to make available everything the brain needs and let it decide what it needs more of. Does it need more L-dopamine? Does it need more serotonin? Does it need more L-tyrosine? Whatever it needs, but it's going to be available. A lot of times when there's emotional side effects to mild traumatic brain injury, many times it's the neurotransmitter imbalance. It's the story of one person can have a concussion and become just angry and aggressive. Another one can become very withdrawn, depressed, all those emotional side effects that can come from that. But again, what I think isn't talked about enough is the lower versions of that. You know, like I said earlier, I was initially caught up in the concussion side of things, but realizing the pro-inflammatory diets that so many people are on or eat nowadays is just creating a low-level concussive state, if you want to call it that. We certainly can call it a brain, a pro-inflammatory state of the brain. Okay, this person's inflammatory process came from a horrible processed food diet. This one over here came from, you know, running into 300-pound guys on Sunday. The overall effect is still the same. One may be a little slower, but you know, the effect's the same. So getting that response under control, getting that inflammation under control is crucial for all of us.
Right. Yeah, and that's so true because, I mean, you see people all the time just with injuries. They have a minor injury, but they have an overreaction to inflammation. The body just starts swelling up uncontrollably. And same thing you think on the brain level. Some people can take these 300-pound, you know, hits to the head. Doesn't seem like they're going to have any effects, but the other person, they might have a genetic issue. They might have an inflammatory issue where they can't mitigate or control the inflammation the right way. And so then it becomes uncontrolled, causes degeneration. We know of the studies on CTE within football players. And I think that was one of your big things you started off in 2008 was just the concussion aspect with, you know, they're trying to rapidly increase technology, but as you said, players are getting bigger, faster, stronger. So they can make these helmets indestructible. These players are still going to be so fast that there's going to be repercussions to the injury itself. And I think what you're doing is great because I think it's more than just, you know, football players. I think it's more than hockey players that can use this product. It's a lot of athletes or even the general public who has declining brain health.
Right.
Going to need these ingredients that you mentioned. And so many people are deficient in magnesium. That's my supplement I talk about every single day. If you come to the office and you have muscle tension, muscle pain, trigger points, it's pretty safe to assume, I mean, I can 9 out of 10 people are going to have a magnesium deficiency. Then we type 4 magnesium, like you know, said earlier. A lot of people think that you can just take any magnesium from Walgreens and be okay, but that's why there's a big misconception with that. And there's a big difference in the mag oxides and the mag citrates out there versus some of the more bioavailable forms, like you mentioned, like the chelate forms. And so I think a lot of people need to know that. If you need to go to the bathroom, the mag oxide is going to help you do that. That's great, right? Very, very affordable. But if you actually want to get a magnesium to your cells, stop pain, stop the stress response, stop, you know, cross over the blood-brain barrier, you're going to have to get a higher, you know, more costly type form. But again, it's not that much. Magnesium is a very abundant mineral that we need, especially in 2020 with the times of stress that we are in. So, so for anyone listening, is this product live now?
Yeah, it's live, saragold.com.
Okay, perfect.
You go to get it. We just wrapped up a study with the NFL players, Retired Players Association last summer, where we had some really good results with these guys that were having some pretty lingering effects from their head traumas. But we implemented near and far infrared light therapy with the supplement. They each got a head harness to take home and use 3 times a day. They took our supplement twice a day. The study was 8 weeks long, and to a T, every one of them had significant improvement, especially in quality of life, probably most specifically sleep quality, which, like you said, I mean, it's just absolutely critical and so underreported nowadays and not talked about enough, the importance of sleep for recovery and healing and all that stuff. So yeah, we're excited. You can go to saragold.com and use it.
Very cool. How long was that study that you did on the ex-NFL player? That's cool.
Yeah, it was a couple months. And we were able to get some really good players. Dallas happens to have the largest chapter of retired players in the country, so we had access to a lot of really good players. And it was, as a 55-year-old, I'm still a kid at heart. And some of these older players that I grew up watching when I was a kid and stuff, you know, I was starstruck. You know, it was fun to talk to these guys. But Rob, on the other side, there were some that were sad. And there's no other way to say it. It's just, you know, and I look at that generation that they truly did not know what they were doing to their bodies. And you know, there's debate out there about who knew what, when, and all that stuff. But, you know, you're talking about in the 70s, you know, through the 70s there, I believe they didn't know. And, you know, you remember the days of, hey, suck it up and get back out there. And that was sad.
Right. Yeah. Because you see the effects in those hits. And my step grandpa, he played professional football for 2 seasons, and, you know, he had some effects with dementia, and it was just hard to see because of all those hits that you're taking with that poor quality helmet, you know, technology they had, you know,
Right.
20 years ago. So it's hard to see that for sure. But I wanted to, I know you, so you launched this new business, you're a full-time chiropractor, travel with the teams. It sounds like you got athletes texting you right now for Sarah Gold on your phone, or maybe that's your fantasy team.
No, that was actually one of the players from the Raiders. He separated his shoulder, and he wants me to take a look at the MRI. So
wow, see, that's so cool. You're a busy man. I appreciate you coming on today. I just want to ask just a couple more questions.
Okay.
Get back to clinic this afternoon. What are your thoughts? You know, and I'm going to say his name because he's on my team, but we all saw the, you know, horrendous injury, the very unfortunate injury with Dak Prescott.
Yeah.
Having ankle injuries myself, I just, you know, I'm
right.
for him. And, you know, was that a turf field that he was on? I couldn't tell.
Yeah, that's real turf at AT&T.
Okay.
Again, the highest tech, the latest, greatest, but still, you know, it is what it is.
Right. And so artificial turf, we know a lot of players complain about getting injured. Just like when you play basketball on a, you know, hardwood floor versus concrete, you can tell in your joints how you feel after playing on surfaces. Have you seen an increase in injuries in turf injuries versus real grass?
Boy, that's so interesting. I would tell you from the real grass, first off, there's so few real grass in the NFL, but if we drop down to college and certainly high school, there's still a few of those. But you know where I'm at up here in North Texas, it's the king of $100 million high school stadiums, right? So
right.
They have turf also. But it's what I typically will see, Rob, is on the turf, I'll see if you want to say catastrophic, the severe connective tissue injuries, the ACLs, the wicked bad ankle tears, etc. On the real grass, I'll typically see the more muscular issues. So you can imagine there's a little slower rebound coefficient on natural grass to where your extremity is under stress for a longer period of time. For example, planting your foot and turning. On turf, there's a little bit more bounce, the new turfs. So you're not under stress quite as long. And the grass is softer, obviously, and keeps that muscle under contracture a little bit longer. And so typically what I'll see is the sprained strains, the pulled hammy, the calf strain, things like that.
From an injury standpoint, though, it's like, what would you rather have? Would you rather have a torn muscle, or, you know, a sprain strain of the muscle, or would you want to have a torn ligament, or, you know?
Yeah. Exactly.
That's kind of the controversy, kind of like the heat and ice versus the real turf or fake turf,
yeah.
right? Or, you know.
Yeah, and again, you know, I understand the business side of it. It's just hard to maintain good natural grass. You know, we take care of FC Dallas, and their soccer field is phenomenal, but they're not taking quite the pounding that an NFL football game would put on.
Yeah, and I've been to Cowboys Stadium a few times, and when I went on the field, it feels like you jump higher. I don't know why. It's kind of got a spring to it. You kind of feel like
it's got some bounciness to it. Exactly.
And I was like, man, I know one of these guys are jumping so high. They're getting an extra 2 inches. If I'm getting an extra 2 inches, they're getting like an extra 12, right?
Yeah, exactly.
Exactly. So, man, thanks so much for coming on today. Is just for the general public watching, maybe they're not an athlete, maybe they're an ex-athlete. What are just some general health tips that you can tell people today to start doing that they're probably not?
Rob, you know me, and you've known me a long time. I like to keep things as simple as I can, you know, for my patients. And one of the things I learned probably halfway through my practice, wish I'd have learned it a lot sooner, but I told you I'm not the brightest guy. But and that was to hold the patient a little more responsible, give them some homework. I think a lot of docs and therapists and chiropractors want the athlete to feel like the chiro is making them feel good. So you got to come to me to feel good. And, I try to get to the point where I want you to come to me to continue to feel good, but you're going to have to, toe some rope in this thing for me, buddy. And so the home exercises, the very simple muscle activation things like a Superman exercise, just to stimulate those paraspinals really well. The swimmer's exercise where you alternate the arms and legs. I'm just big fans of firing that kinetic chain, non-weight bearing, so that the brain and the neural firing can really kind of reset itself. I love that before bedtime. Obviously, the old standards of more water, right? Better sleep, all those typical things. But that neuromuscular re-education firing before bedtime, I've been utilizing a lot in the last decade, and it seems to work really well for so many of the athletes, and including myself when I do it. And obviously, the foam roller and the things like that are still crucial. I will say this, there's been.
You went on mute.
Rob, you know as well as anybody that with elite athletes, if a little's good, then a lot's got to be better, right? And
exactly. Yep.
Percussive massagers that a lot of them ended up getting, like for Christmas or treating themselves to, they would sit there and they use way too much pressure for way too long on very tender areas like the Achilles, and they end up creating inflammation and irritation in some of these areas that they're working on. And so trying to teach them, in the bellies of muscles, go to town and get in there and break it up. But when you start moving down that musculotendinous junction or into tendons, in joints, you got to back off. And so, that's been something here recent that I'm seeing a little bit more of, and trying to educate them on how to use a good percussive massager.
Right. Yeah. Those are so popular that there are guns out there. I have one too. I love it.
Yeah.
Mine from a Facebook ad. I don't know how to tell me, but it took like 6 weeks, got it in from China.
Yeah.
Came in the mail. So I'm excited for that. So for your adherence, that was interesting. You tell your athletes to do their exercises before bed. Have you just found that if they try to do it before they leave for work, or if they try to do it, during the day, it's not going to happen, but right before bed, most people can remember to do that?
Yeah. I that's what I've had the best success with. Again, everybody's schedule can get so crazy, but especially these athletes that are on a tight schedule. But, we're talking about, and I tell them, we're talking about a minute, maybe 2 minutes to knock out these activation motions. So don't roll in here and tell me you didn't have time to do them. Right.
Exactly. And I've always been saying that too. I do my stretches at night usually before I go to bed, do my couch stretch, my lunge stretch, Superman, McKenzie's, planks, bird dogs, all of the, and it takes 5 minutes. It's very quick. If you know what you're doing, you've been doing it for a while, you can knock them out pretty quickly. So just in adherence, just the more I do it, the easier. Sometimes when the kids go to bed later, it's hard to do the exercise, but
sure,
of course, but we're older athletes. So I guess the last question is, you've been doing this for so long, is there any advancements or anything you see that's going to change in the next 10 years? Like, we know that things are rapidly changing every year. Is there anything that you can see on the horizon, or that you wish to see on the horizon for?
Well, again, Rob, I can't sit here and tell you I know of anything, offhand, that I see imminent. But one thing that does concern me is the shotgun approach that I worry about some therapists, including chiropractors, doing. And what I mean by that is doing such a broad range of treatments on a single visit. And for example, I'll tell you that there's a therapist that works with some of the Cowboys that I've disagreed with a few times with some of the players, because they'll want to do deep tissue massage, cupping, dry needling, deep muscle Russian stem, near and far infrared light therapy, all in one visit, all in one treatment session. And then, then the athlete may go do cryo or something. I mean, just this, I like a more systemic approach, systemized approach to where you can assess the response better. Again,
Right.
if you got to see what's working, what's not for that particular athlete. Maybe cupping, that is not good for that athlete for whatever reason. Maybe the acupuncture is not good every visit for that. So that's what I think as therapists try to hone their protocols, it still needs to stay very individualized.
So is that the spray and pray method, the shotgun approach?
Exactly. That's exactly right.
Let's try it all. Let's see what happens. One's got to work. If I use 10 different modalities, one of these 10 is going to work, and we'll say it's the whole thing, and then we'll patent it and we'll sell it at seminars.
Amen, brother. That's exactly right.
No, I'm just kidding. But yeah, this field is always, challenging. There's always new things to be aware of and always new things to learn, and not everything's going to work for everyone. But I love your approach. And I referenced you. I had a previous podcast with another colleague. We were talking about one thing that you said is very insightful to me, and I know this will be done in about 5 minutes. But you told me you had a kind of an epiphany because you were, treating these professional athletes, and you had a track runner that you had like stretched and you done all the mobility on, and you worked and worked and worked on them, for about an hour, I think you told me, and then they performed worse and their sprint or it was a hurdler, but
no, it was a sprinter. It was a sprinter.
It was a sprinter. Yeah. You're just like, yeah, because I stretched the fast twitch muscle fibers too much and I got them too relaxed. And so that was like, hey, let's do enough to make this athlete perform better and also decrease our chance of an injury. But you've got to know the sport, you got to know what you're doing. You got to have goals in place, right? And so that was very profound because most people, if I was first starting, I was like, let's do everything. But then there comes that, hey, if we do all these things, you might perform, not as good. And we know for athletes, that's the one thing they do not want. So,
boy, right? That's exactly right. I've told that story. I tell almost all my interns as they come through, a version of that story because that was it. Epiphany was a very kind word to say. It was more of a OMG moment when I watched the results of the race and watching him shake his head like, what in the world just happened? How did I do that bad? And I'm kind of hiding over in the corner like, you've seen that Homer Simpson meme where he's backing into the shrubs.
Yeah.
And that was me. I was like, oh, geez. Okay. So anyway, live and learn, brother.
Live and learn. I appreciate that story. That helps, us as practitioners grow and learn as well. So for anyone listening, where can people find you at? Where can they find you online? Where can they find practice?
Well, it's VSM Texas. It's Vitality Sports Medicine. VSMTexas.com is our website. At Dr. Ford 11 is my Instagram and Twitter. And always happy to help anybody that needs help. And like I've told you, if they come up with a question I don't have an answer for, I'll tell them I don't know, and I'll try to find an answer for them.
Awesome. Well, I really appreciate everything, Doc. I know you got a lot of players texting you this morning, so I'll let you get back to that. But thanks again for coming on, and I look forward to maybe having you back on in the future because I'm sure we're going to have a lot of follow-up questions to this episode. So thank you again, Doc.
Rob, my pleasure, buddy. And listen, I just want everybody that's listening to know how much I absolutely love and respect Dr. Rob. He's one of those interns that walked through the door. He was in the first class of interns that I ever had. So I've always apologized to him for however bad I screwed him up maybe, but I learned a lot from him. He was one of those that when he walked through the door, you're like, this guy's got it. He's going to be a great physician. He's going to be a great doctor. He's going to be successful. And dude, it's just always my pleasure to help any way I can, Rob.
Hey, I appreciate that, Doc. Very kind words, and I'm glad to learn from the best. And I got a great experience with you. Hey, we even got to play a little basketball inside the clinic. I know your wife made us quit the basketball game really quick during our lunch breaks, but we had a lot of fun and learned a lot. We did.
It was good. All right, Rob. You take care, brother.
All right, you too.
All right, we'll see you.
All right, sounds great.